Hi, it's Noel Williams, June 28th, 2020, COVID update. Optimal Health Associates, Oklahoma City, Oklahoma. Statistics, COVID's going up very much around the world and in the United States. We had 40,000 new cases today, and that's kind of been our average the last few days. We're at 125,000 to 128,000 deaths. We're over 2.5 million total cases. This reignition of the first wave is in full swing, originally from probably the restrictions being relaxed towards the end of May, followed then by the big Memorial Day weekend, and then the demonstrations. Things are really getting a little scary again. So we all need to consider what that means for us and our approach. If we look at Texas, they've been averaging 5,000 cases a day the last several days. Florida's kind of turning into a nightmare. They're at 8,500 cases plus the last 3 days, with one day being well over 9,000. They had 40,000 new cases over the course of the last week, but again, 24,000 in the last 3 days. They've shut their beaches. Texas has cut back on bars and all that stuff. Arizona is about 4,000 cases a day right now. They'll be probably shutting down a lot more. Many of the states, Colorado, New Mexico, Oklahoma, South Carolina, the whole South and West is having a big increase. But just to keep it in mind, I mean, Oklahoma had 299 cases in the last 24 hours, which is better than the 400 plus we had the couple few days. But just keep in mind, in New York City or New York, they're at a low, and they're at about 580. So, I mean, yes, there's a lot less of us, and we are having an uptick in cases, but at least in Oklahoma, it's still relatively a small number. And we just need to really hone down here on masks, which I'm amazed to see so few people wearing everywhere, but we really need to be in masks. We really need to be washing our hands. We really need to be taking our supplements. You start looking at who's getting the virus. It's the 18 to 40 group, probably a cluster is going to start hitting all these high school students who've been getting together, who just graduated. We're seeing lots and lots more young people get infected. Thankfully, they're not getting as sick. There's a cluster in Michigan, from Michigan State, where 85 kids or college students went to a bar that had just reopened, and they all got COVID, and then they spread it to Grosse Pointe. So far, virtually none of them have gotten ill, but they have gotten, most have gotten some level of symptoms. So we just have to be really aware that it's not safe to do large group activities. I want to emphasize that. I think you can do smaller group activities. I think you need to socially spread. I think you need to wash your hands. You need to be on your zinc. You need to be doing all the things we've talked about. I mean, a lot of silence from the FDA, CDC, NIH, other than, we really need to be wearing our masks. Anyone who's not on board with masks, or who criticizes you for wearing masks or any of that, again, just understand they may not be reading that much in terms of how masks work. They can both inhibit the spread of the virus from an infected person, and they can limit the infectious opportunity of the viral particles for an uninfected person. And then you start trending things, they certainly appear to be quite helpful, and they are certainly not harmful, especially if you're washing your hands. So just keep that in mind. So really the news of the weekend is this huge increase in cases, all still part of the first wave. I think it's teaching us very clearly we're going to need to get very strict with our activities and our interactions, and really focus on the vitamins. You have to be taking the zinc if you're older. I mean, I want everyone taking the zinc at this point, but if you're older, you also need to be on the melatonin. You also need to be on a multivitamin. You also need to be vitamin D, taking vitamin D. And remember, for those of you who really want to get into natural approaches, turmeric is a huge interrupter of inflammatory cascades, and so that's always helpful too. But I think our core stuff we've talked about is just more applicable than ever. We'll have to see what happens over the next week or two. Like I've mentioned, there's really nothing coming out of our governor's office. I think we have to look to David Holt, our mayor in Oklahoma City, for direction in terms of closings. I would not be surprised if the trend stays up at 400 to 500 through the first part of the week if bars don't get closed by next weekend. And in fact, I would expect that and and I'm sorry to say I would hope for that, because we really need to cut it out now while we can before it gets worse. We don't want to turn into Texas or Florida. And that's really the summary. Kim, any other thoughts?
You've had several questions about zinc and melatonin if you're pregnant and or breastfeeding.
So melatonin is, again, 1 to 2 milligrams of melatonin is always safe for breastfeeding moms or pregnant women. Zinc's safe for pregnant women and breastfeeding moms. There was a report from the American College of OBGYN that was the first of its kind last week that suggested that some pregnant women might be getting sicker than people who were not pregnant, but that's a initial report and has not had any further substantiation or correlate anywhere else in the world. So that's something I'll be following. Again, doesn't make sense physiologically, but we need to, of course, since there's a new data point that American College of OBGYN reported of potential increase in illness in pregnant women, we'll all need to be following that as physicians and providers. But again, just a new report on that. There hasn't really been any other information in terms of, kids are still not getting sick. They get a little sick, but they don't get ill. The 20s to 40s for the most part do not either. It's, again, the cluster of cases of significance is really the older people. And so if you're an older person, you have to be more careful than a younger person. The younger people may get sick, but they're not going to die. The older people can get sick and you can die from the disease. And so you need to be very careful around with your surroundings. And again, younger people, especially children, are not transmitting the virus to older people, but as we start to get into our 20-somethings, they do have the potential more to transmit the virus to older people. So, because they're adults and their immune systems are not kid immune systems. Anything else? No, so just kind of do your best to maintain sanity in these trying times. Exercise, get out in the sun, socially distance, and be safe. Take care. Good night.